Hi guys, this is Kit with Serenity Health. I am the anesthesia provider of Serenity Health, and today I just wanted to talk to you about some of the things that I do believe a particular infusion facility or a Spravato certified facility need to have in order to keep our patients safe. Okay, so I've kind of come up with an acronym. Bear with me here. I'm not really an acronym person, but I want to have something for you guys that is easy to remember so that when you come into a facility, you can adequately assess if they have these things so you can feel comfortable and know that your best interests are being put first and that you're being kept safe. Okay, so first thing is letter C. Obviously, you want to come to a place where it's clean. C stands for clean. Make sure that it's clean, and also kind of like, feel the general atmosphere of the place to see if it's soothing or if it's something that can worsen your hallucination. It could cause other adverse effects that may actually hamper your experience. Just remember, ketamine can cause some hallucinations, and when you hallucinate, other external stimulus does not help. So you want to be able to try and minimize all those stimulation. That way, if you begin to hallucinate, it's easily controlled by decreasing all those stimulus and you're still being kept safe. Okay, so that's the letter C. Letter O stands for openness. I know there's a lot of facilities out there that pride themselves for making these proprietary blends. But guys, what you want to remember is that all those proprietary blends have not been well studied. So it might work, it may not. Do you really want to be the one to actually take the hit if it doesn't work? Chances are no. So you want to be able to know what they're actually giving you and how much. That way you can do your own research to see if those doses are actually adequate in keeping you safe and your best interests. The doses that we utilize are the ones that have been backed by studies and also experts' consensus have actually agreed upon that this is a safe dosage to be provided in order to help in getting the results that we want to achieve. Okay, so that's O, openness. M stands for monitors. Okay, you want to come to a place where they're adequately going to monitor you. Okay, so here we actually do a pulse ox where it actually measures your oxygen saturation every time you breathe. We do a blood pressure cuff, which measures the blood pressure, obviously, and we also do EKG leads. Some facilities do not do EKG leads, but we want to do EKG leads because ketamine can increase your heart rate and also your blood pressure. If those things increase and you have what we call coronary artery disease, you could have what we call an ischemic event or a heart attack. And with ketamine having some pain relieving properties, you may not feel chest pain. And so for us to be able to keep you safe, we want to see the EKG because that's the one that's going to tell us the electrical changes in the heart. If you're having some sort of ischemic event, we can see it in the monitor and we can see the changes right then and there. You may not be able to feel the chest pain, but we can see it. Okay, so that just kind of puts your best interests at hand. All right, so that's M. Letter E stands for emergency preparedness. Okay, so obviously if you have a heart attack, what are they going to do? Okay, you want to be able to come to a place where they have a defibrillator so they can intervene should your heart stop and do what they need to do. Okay, that's just one piece. Ketamine can cause your larynx to spasm or close up if you become unconscious and something touches your vocal cords other than air. So when that happens, we need to actually be able to intervene by utilizing our airway supply. So you want them to have adequate airway supplies and adequate medications. Okay, so it's not just being able to shock you, but it's also being able to give you medications to help keep you safe and get you back to where you were should those things happen. Now, are those things going to happen? It's a very low likelihood, but we don't want to take the chance, and neither should you. Okay, last but not least is what we call the IN or IN in C.O.M.E acronym, which stands for interdisciplinary communications. So we pride ourselves in being able to communicate with other practice that our patients go to. We try to send them, the before and after results. And it's not just so that, we can show them how effective the treatment have been, but it's also because we want them to know that you've received a medication, so they shouldn't give you any medication that could interact with that medication should you visit them soon. Again, it is for your own safety. You know, one doctor can prescribe you one medication, and if that happens to be something that ketamine can interact with, which there are medications out there, then, you know, you're the one that's actually on the losing end. And we don't want that. So we want to be able to communicate with all other providers that actually prescribe you medications that you've received ketamine, so that they know not to give you anything that could interact with it and cause you harm. All right? If you guys have any questions, please feel free to give us a call. Our number here is 888-442-HEAL. That's HEAL, or 4325. You can call or text that number. Again, that number is 888-442-4325. Thank you.